Hey guys, Will Workman here with Workman Protection, here to make your concealed carry life better. Today I've got my good friend Dr. Joel Madison with me. He's an ER doctor and he is going to go through my trauma kit with me to kind of tell me some of the do's and don'ts, maybe some good things that I have in there and maybe some things that I'm missing. First of all, if you're trying to build a trauma kit, I want to encourage you to check out Mountain Man Medical. They have some incredible resources on their website, both educational links as well as trauma medical gear. Definitely go check them out. My affiliate link is in the description down below. So, I want to talk about trauma kits. Trauma kits are super important for concealed carriers because it's much more likely that you're going to need a trauma kit than it is that you're going to need a firearm or OC spray or anything like that. Trauma gear is essentially some heavy duty first aid gear. So it's more than just a boo-boo kit, but it's really to stop severe bleeding. I kind of have two parts to my trauma kit. Some people might think this is cheating, but that's okay. So this all together is my trauma kit. This goes on my body every day, and this tourniquet just goes in my back pocket, and then this is kind of the extension of that goes in my car trunk. So I'm gonna let Joel go through it, see what he thinks.
First off, trauma shears, great, I love it. We use these all the time. If you are in a situation where you need to do chest compressions, then you want to have somebody else, ideally, take the shirt down.
Gotcha.
That way, if you have pads to place, then you can put them on the skin. So definitely want to expose the chest as soon as possible in a CPR situation.
When else would you use trauma shears?
So if you have a motor vehicle accident or motorcycle accident and they are mangled, banged up, and they're bleeding, and you just see blood-stained clothes, you want to get those clothes off to expose the area and see what you're dealing with.
Gotcha, figure out where the wound is.
Exactly.
Okay.
Band-Aids.
That's my little boo-boo kit.
I love it. Chest seal. So this is used for what's called sucking chest wounds. That's where you have a penetrating trauma into the chest.
Hemopneumothorax, right?
Hemopneumothorax.
Hey, I knew something.
Anytime there's a penetrating trauma to the chest, that allows air in between the chest wall and the lung. That doesn't allow expansion of the lung, and you can't breathe. So putting a chest seal ideally is going to prevent air from entering that wound. So anytime you have a penetrating trauma, gunshot, arrow, harpoon, you can slap one of these on a sucking chest wound or bubbling.
Right.
I wouldn't really recommend waiting for that. I would just put it on.
Just stick it on.
If you see a wound in the chest or the cardiac box here,
Gotcha.
slap it on there.
Okay.
What is this?
It's an Israeli bandage pressure dressing that has a plastic hook on it.
Oh, yeah.
Yeah, so you hook it through the plastic piece and it helps hold the pressure.
Yeah. Okay, so this is great. We can go ahead and talk about this and tourniquets because this is all about bleeding control. If you were to walk me through or walk somebody who does not know anything about how to stop bleeding, what would be kind of the tiers?
As long as it's not a arterial bleed where there's splurting blood, then you would find, if you have a trauma kit, great. If not, some type of cloth or a t-shirt or something to add pressure to try to stop the bleeding.
Definitely. Yeah, there's actually a campaign out here called Stop the Bleeding. So Stop the Bleeding is a pretty simple three-part structure. The first is where you just apply pressure. This is pretty independent of where somebody is bleeding, unless it's the skull and you suspect like a skull fracture. But anywhere from here down, if somebody's bleeding and you want to control it, put pressure, hold that for 10 minutes. Be mindful of how long you're holding it. If you're still bleeding, and we're not talking about arterial bleeding, but if you're still bleeding, oozing through that, then the next step is to pack the wound.
Right.
So if you have gauze or bandages, anything really, you're going to pack that in and you can apply a pressure dressing.
Gotcha.
And so that's where this comes in handy. If you soak through that, they're still bleeding and you suspect they're bleeding to death,
right,
then the third and final step is applying a tourniquet. Tidbits about tourniquets. Extremities, it's great use. Neck wounds, not so much.
This should go without saying, but if you put a tourniquet around a neck, that's not first aid, that's homicide.
Extremities, good. Everything else, not so good.
Right.
Junctional bleeding, that's here, here. It's really hard to get a tourniquet around that. And so packing, pressure, It's really your only options
Right.
in that case. We have two tourniquets here, the CAT and the SWAT T. I was actually not very familiar with this, and so I was looking into it a bit. I'm not crazy about the idea of me being in the ER and EMS bringing a patient in with one of these. We take down the tourniquet to see if there's arterial bleeding. If you can go through the steps of stop the bleed, of pressure directly, packing it, pressure bandage, and that controls the bleeding, then avoid a tourniquet at all costs.
Is it true though that a tourniquet can be on for safely up to 2 hours without it causing permanent damage to the limb?
Yeah, that's about the time frame that we look for. If you are applying a tourniquet, the first thing you want to do after the bleeding has stopped is check the time. Do you have a pen or a pencil? Ah, man, love it. Oh, that's even better. So you want to write the exact time of when this is applied. It does have profuse arterial bleeding, which I've seen a few times, and the response to that is us putting that tourniquet back on.
Right.
And then they go to the OR immediately. That's where I kind of have an issue. I love these with the bar. It's screwed on. We unscrew it and see if there's bleeding. If there is,
You can tighten it
we
back.
tighten it back.
Okay.
Yeah. This one, I've never actually seen used. Have you tried this out before?
Yeah, so I have to agree with you that this SWAT tee is not ideal in my opinion. The one thing that I like about it is it works pretty well for a lot of things. It doesn't work amazing for anything, but it's essentially a big wide rubber band. You could potentially use it as a chest seal. You could also use it if you are doing wound packing as a pressure dressing to really hold that down. In a pinch, it can be used for a tourniquet. If I were shot in the arm, especially if I had to put a tourniquet on myself, I would 100% rather have the CAT tourniquet on me than the SWAT tee. But I would much rather have the SWAT tee than nothing.
Having something to get them into the hospital alive is great. If someone has one of these on and they're alive, we can deal with it. I would recommend one of these. So this is great too. This is Quick Clot. I have used this before. It does an okay job.
Yeah.
If you have this, then use it. If there's concerning bleeding, then there's no harm in using this.
Gotcha.
All right. Let's see what's up with this. Naloxone, that's great. This has saved so many lives. Naloxone is an antidote for opioid overdose. It does an amazing job. You just put it up the nose and you spray it. And if they are overdosing on opioids, they will pop up
Like a jack in the box.
Yeah. It is unbelievable how well this does with overdose.
Right.
I would use naloxone if there's any chance they're overdosing. It doesn't hurt. If something else is happening and you give somebody naloxone, it's not going to devastate them. Whatever else is happening with them
Right.
has to be dealt with, but naloxone itself is fairly benign.
It's an emergency blanket.
Love it. All right, so emergency blanket. I'm guessing this is like a thermal insulator, right? So this is good for hypothermia. Hypothermia is pretty insidious. Gloves. If you're doing really anything that has blood or bodily fluids involved, if you have enough time, then slap on gloves. We got some gauze.
So fun story about these gauze. Those actually came from the back of an ambulance because the car wreck that I was behind, I had to use all of my gauze on the lady that was injured. And when the ambulance got there, they were like, "Where did these gauze come from?" And I was like, "Oh, I wrapped her up because she was bleeding pretty good." And he was like, "Well, do you want me to refill your trauma kit? You want some extra gauze?" And I was like, "Sure."
Nice. Band-Aids.
I have kids, you know. Well, Joel, I want to thank you for coming and sharing some of this with us today. Hopefully this helps you too as you're building your trauma kit or changing things in your trauma kit. Definitely check out Mountain Man Medical. Again, that link is in the description. Get some good quality trauma medical training. The American Red Cross does the Stop the Bleed campaign. Go check that out. It's a free resource. Like and subscribe below and comment and let me know what other videos you guys want to see next, and we'll see you next time.
So that's great.
Good night, buddy.